Here Mondays being pre-recorded. We will be talking about how Medigap plans work with Medicare. Medigap policy. Medigap policies are healthcare insurance policies that offer standardized healthcare benefits only to work with Original Medicare. They don't work with Medicare Advantage plans. Medigaps are sold by private insurance companies. If you have a Medigap, it pays part or all of the costs after Original Medicare pays first. Medigaps may also cover healthcare costs that Medicare does not cover at all. For example, you may get covered when traveling abroad. Each state has their own insurance division. In Rhode Island, that is called the Department of Insurance Healthcare Commissioner. This entity oversees which companies and which plans can be sold in Rhode Island. For other states, please refer to each state Department of Insurance. You may also want to note at this point, you should also enroll into a standalone Part D plan so you incur no penalties for that portion of Medicare. What do Medigap cover? We see it covers Part A hospital coinsurance. We have Part B coinsurance, the first 3 pints of blood, Part A hospice care coinsurance or copayment. It covers Part A skilled nursing facility coinsurance. It covers the Part A deductible. It covers the Part B deductible. It covers Part B excess charges. Please note, in Rhode Island, there is no Part B excess charge. Here we look at a basic Medigap covers and what will be covered under each policy that may be sold in your state. Medigap work with Original Medicare. It helps pay for some or all of the costs that Original Medicare does not pay. Medicare pays first, and then Medigap will usually come and take the rest of the bill away. For example, let's say you have Original Medicare and a Medigap, and you go to a nearby outpatient clinic to get a medically necessary chest x-ray. First, Original Medicare pays 80% and then of the Medicare approved amount, and then the Medigap policy will usually cover the other 20%. A Medigap is not like other types of secondary insurance. When you have secondary insurance, such as retiree coverage, the retiree plan makes decisions about whether or not it will pay for services after Medicare pays. Even though Medigap policies are offered through private insurance companies, they do not make their own coverage decisions. Difference between Medicare Advantage plans and Original Medicare with Medigap policies. Looking at what Medicare Advantage plans cover, you typically see only in-network providers. You typically need referrals to specialists. Your cost sharing varies depending on the plan. You usually owe a copay for in-network services. Your plan may charge a monthly premium in addition to Part B premium. May cover extra services that are not covered by Original Medicare and not covered by most Medigaps, such as vision, hearing, and dental. Those policies would be separate. You may use the fall open enrollment period, which is October 15th to December 7th, to pick a new Medicare Advantage plan or switch between Original Medicare and Medicare Advantage. Now let's see what Original Medicare with Medigap covers. You can see any provider and use any facility that accepts Medicare. You do not need referrals for specialists. Your Medigap pays part of or all of certain remaining costs after Medicare pays first. Your Medigap generally only covers Medicare cost sharing. However, it may also cover costs Medicare does not cover at all. For example, 365 additional lifetime hospital days or care received when traveling abroad. And you must enroll into a Part D plan so you do not incur any penalties for that Part D. Choosing a Medigap policy. There's many insurance companies, and they may offer up to 10 different Medigap policies to choose from. They are labeled as Medigap Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan K, Plan L, Plan M, and Plan N. Each lettered policy is standardized. This means that all policies labeled with the same letter have the same benefits. Companies may sell the same Medigaps for different prices, even though they have the same coverage. Listed below are some of the things you should consider in choosing a Medigap policy. One of the things that you may consider is Plan A offers the most basic coverage. Plan F and C and G are the most comprehensive Medigap policies. They generally cost the most. Plan F and C are only available if you are eligible before January 1st, 2020. Medigap plans are guaranteed renewable. This means that as long as you pay the premium, you can keep your plan. However, premiums may change yearly. Shop around. Different insurance companies charge different premiums for the same exact policy. Things to know about Medigap policies in Rhode Island. If you have a choice of the following policies in Rhode Island, you have Plan A, Plan F high deductible, Plan G high deductible, and Plan N. In some states, excess charges are limited or prohibited. As stated before, those states will include Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, and Rhode Island and Vermont. Medigap Plan C is no longer sold to anybody. If you are in that plan, you may stay in it. However, if you leave that plan, you will not be able to get back into it. Plan F is no longer sold unless you had reached the age 65 before December 31st, 2019. If you are in that plan, you may stay in it. However, if you leave, you may not be able to get back into it. Any plan that has an HD after it means that it is a high deductible that you must meet. You will pay $2,870 before that policy will help you with any bills. Plan N has some copays associated with it. They are a $20 copay to any doctor you go see, a $50 copay to any emergency room you go into. Unless you're admitted, that copay will go away, and you must pay the Part B deductible. How much do Medigap policies cost? When you're choosing a Medigap policy, it is best to look at the policies from a range of insurance companies, especially if you've already decided on a particular standardized policy. Policies with the same letter offer the same benefit, but premiums vary from company to company. For example, policy A bought from company 1 has the same benefits as policy A from company 2, but company 1 and 2 can charge a different rate. When choosing a Medigap, ask what factors the Medigap insurance companies use to set their premiums. The following factors may affect the cost of your Medigap: where you live, your age, your health, your gender, if you smoke, if you don't smoke, if you are married, if you're not married. How much do Medigap policies cost continued? Beware of how Medigap companies use age when setting premiums. In some states, companies are only allowed to use age to set premiums in certain ways. Depending on your state, premiums may be obtained as no age rated, issue age rated, and attain age rated. Please note, Medigap policies can only be sold by licensed brokers in the state. When can I purchase a Medigap policy? If you wish to purchase a Medigap policy, you need to find out the best time to buy one in your state. In most states, insurance companies must sell it to you at the time you turn 65 or when you first enroll into Medicare Part B. If you miss your window of opportunity to buy a Medigap policy, your costs may go up. Your options may be limited, or you may not be able to buy a Medigap at all, depending on your health status. When should you buy one? The first time you should buy one is at open enrollment period. Generally, the best time to enroll is during your initial enrollment period. Under federal law, you have 6 months open enrollment period that begins the month you are 65 or older and enrolled into Part B. During your open enrollment period, Medigaps must sell you a policy at the best available rate. And then we have a guaranteed issuing rate. This guaranteed issuing rate is at age 65 or when you first enroll into Part B. Please note, you may run into problems, especially if you have pre-existing conditions when you purchase a Medigap policy outside of these protected enrollment periods. Can I cancel a Medigap policy? You have a right to review a new Medigap policy for the first 30 days. You can cancel it within that time for a full refund if it does not meet your needs. After the first 30 days, you can cancel that policy at any time. However, be careful when canceling. Depending upon where you live, you may not be able to buy another policy, or companies may be able to charge you more because of your health. You also have the right to a 30-day free look period if you want to switch your Medigap policy. If you decide to apply for a second Medigap, you will have to pay both Medigap premiums during this 30-day period. Your 30-day period begins on the day you enroll into your new Medigap policy. You should not cancel your first policy during this time because you may not be able to get back into it. Do Medigaps work with Medicare savings programs and Medicaid? Well, Medicare savings programs and Medicaid are assistance programs that help you with your healthcare costs. Medicare savings programs pay for your Part B premium at minimum, and Medicaid pays for some of your healthcare costs after Medicare and any other insurance has paid. In general, it is illegal for somebody to sell you a Medigap policy if you have already been enrolled into Medicaid or MSP programs. That covers your Medicare cost sharing. However, if you purchase a Medigap before you enroll into these programs, then you are allowed to keep your coverage. If you are over the income for Medicaid or MSP, Your Medigap premiums may be used to lower your monthly income by the amount you pay for the premium. Additionally, if you have Medicare, Medicaid, and a Medigap, your Medigap can pay for services you receive from a provider who doesn't accept Medicaid. Please note these circumstances only apply if you have a Medigap before you qualify and if you're enrolled into Medicaid or an MSP. You cannot purchase a Medigap after you are enrolled into Medicaid. What should I do with my Medicare statements? Reading your Medicare statement notices or your explanation of benefits is a very important strategy for detecting potential Medicare fraud, errors, or abuse. Keep the following tips in mind. Review yours or your loved one's Medicare statements as soon as they arrive. Confirm that everything listed on these statements is accurate. Keep notes of your medical appointments and compare them to your statement to ensure that your MSNs or EOB are accurate. Contact your healthcare provider or plan if you have any questions or notice any errors on your MSNs or EOBs. Contact the Senior Medicare Patrol for a printed My Healthcare Tracker, which helps you pay and which helps you track your appointments. Or download the mobile app, the SMP Medicare Tracker, which includes a My Healthcare Tracker by clicking the QR codes for the Apple Store or the Google Store. Who should I contact for questions? Call your state health insurance program at 1-888-884-8721. Call your Senior Medicare Patrol unit at 1-888-884-8721 if you find any errors on your statements. Or go to the Medicare.gov website for online help comparing Medigaps in your area. If you decide to purchase a Medigap, call the plan directly to purchase the policy. Should you need further assistance, we have several partners in the state of Rhode Island. They are Aging Well, Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, the Rhode Island Aging and Disability Resource Center, the East Bay Community Action Agency, the Leon Matthews Senior Center, the Progresso Latino Center, Edward King House, and of course the state Rhode Island SMP SHIP and SMP line. Thank you for viewing this presentation. Please feel free to contact us if you have any questions. My name is Kim Timpson. I am the Health Insurance Coordinator, along with my colleague Jennifer Rios, who is the SMP SHIP Volunteer Coordinator.